So, if you've been struggling with insomnia for a while, you've probably done your due diligence and your research on the number of different treatments out there, either from your health professionals or self help books or random Reddit comments from people who've struggled with insomnia. You've probably done and went across a smorgasbord of different possible alternatives. But today I'm actually going to focus on two of the different types of treatments that have had the most evidence in support of their efficacy, which is sleeping medications or hypnotics, as well as cognitive behavioral therapy for insomnia, otherwise known as CBTI. So I'll talk about some of the pros and cons of deciding as to whether it makes better sense to use hypnotics, sleeping medications, or go for a non-pharmacological route, CBTI, and talk about some of the considerations you can have before you make a decision that feels like a good fit for you. Hi, welcome to the channel. My name is Dr. Parky. I'm a clinical psychologist and a behavioral sleep medicine expert. And in this channel, I talk basically everything about evidence-based treatments for chronic insomnia to hopefully get you out of the insomnia trap and get you back on track. I'm also the author of the Insomnia Paradox, which is the self-help book that teaches you the strategies that are non-pharmacological in nature that helps you to get you where you want to be and be a good sleeper. So let's do this systematically. Let's start with the pros for the medication. So the pros that I see with the medication is that it is actually a powerful evidence-based treatment, especially for the short term. You take the medication, you get knocked out, and off you go into dreamland. So it's a very fast-acting, effective treatment, especially in the sort of short term, especially if you're dealing with kind of stressful situations and you just know you need to be knocked out for the next 8 hours and kind of get your sleep back on track. It can be really, really helpful for that. It's usually also a pretty cheap cost. You can get a lot of it from your prescriber or even over the counter. There are some treatments that or medications that can be quite helpful that could be taken and bought just kind of in your regular pharmacy. So pros are that medications are cheap, effective, and quite accessible. What are some of the cons? So some of the cons are that when you stop using medication, your sleep problems get worse typically. So there's sort of the phenomenon known as insomnia rebound, where for a little while after you stop using sleeping medication, your sleep problems actually get worse. And second of all, for the people who struggle with insomnia disorder, the medication can be seen more as like a band-aid rather than an actual treatment for the underlying wound. So the cause of the insomnia is not particularly well treated. So many people who discontinue using medication, if they struggle with sort of signs of chronic insomnia, like, sleep anxiety, are going to find it very, very hard to be able to actually get off of it without seeing a significant increase in their ability to sort of sleep well. So that can be sort of a nasty side effect of getting off the medication. Along with, getting on the medication, it has its side effects for people as well in terms of feeling a little bit drowsy. There's certain medication that can increase risk fall, like benzodiazepine. So there's just, of course, a sort of profile of different side effects that are a result of, engaging in hypnotic use. So unsurprisingly, given a choice, most patients and providers wouldn't want to be on sleeping medication if they didn't have to be, which, of course makes sense. And the side effects and the fact that it isn't a really great long-term solution ends up making it less attractive, at least in the long run. Now let's talk about the benefits of CBTI. So in terms of the research evidence, in the short term, CBTI is actually quite comparable to sleeping medication, but where it really shines is that after finishing up CBTI, the effects remain quite robust and durable even years after treatment. So even when you're not engaged in active therapy anymore, you still see those benefits. And this is where medication and CBTI really differ, where CBTI addresses these underlying causes that maintain and perpetuate chronic insomnia, such that as a result, once you've finished treatment, you've kind of in some ways like done surgery to cure the wound, and now you can kind of go on with your life without ever worrying about the insomnia coming back as substantially as it did before. So CBTI tends to be a lot more of a robust and durable treatment because after you finish treatment, you still sort of reap the benefits for years on end. And certainly as a result, it is preferred by both provider and patients when they're aware of this alternative because, you don't want to be on medication if you don't have to be. And it's certainly much better to really make you feel like, oh, I'm the person, my body is capable of producing sleep rather than feeling like, if I didn't have that medication, like as a crutch, I would be totally screwed. Now, the cost of CBTI, unfortunately, is the significant cost. So there are self-help books like, my book, there are, online courses, but if you are wanting, support from a trained provider, then that is going to be somewhat costly. But maybe certainly compared to 30 years of insomnia, a few hundred or few $1,000s may not necessarily be too bad of a sort of trade in terms of equivalent exchange. So that can be quite nice to know. And of course, CBTI does require some amount of work. It's not just like a medication where you take it and all all of a sudden your sleep gets better for the night, but it is something that you have to put in some amount of effort between sessions to really reap the benefits of engaging in these strategies. So after weighing the pros and cons, I would say that when it comes to medication or CBTI, for short-term sleep problems, I do think medication can be a great strategy. Like it's just something that you take, you fall back asleep, and it can be great if you're, for example, traveling across time zone and you just need to get your schedule back on set, or if you are dealing with some stress and it's hard to sleep right now because of an exam or you recently broke up with your partner, might be a reasonable alternative to take medication just to kind of get those hours and then get back on schedule when the sort of time and place kind of allows for it. Whereas on the other hand, if you're struggling with insomnia disorder for months or years, then it can be quite helpful for you to go for a CBTI route because that actually addresses the underlying causes and then allows you to have more long-term sleep health without the use of medication or another type of crutch. So thanks for watching. If you found the video helpful, I encourage you to subscribe because I'll be continuing to make videos just like this down the road, really help you to become your own insomnia therapist. Otherwise, I'll see you in the next one. Bye-bye.